We've already been talking about the issue of rationing and the fact that the decision-making is coming down more locally. It's happening at hospitals here. It's happening at GP level in the UK. This is a trend which is happening incredibly fast. In my country, it's happening for one really big reason, which is the only way politically to enable hospitals to close and health cuts to happen is to get doctors who are as local as possible to make those decisions so they get assassinated instead of you. And that's what's happened. So a friend of mine is in the business of closing a big local hospital in my town. He has hate mail. He's had 5,000 or 6,000 people out on the streets shouting his name. They are determined the hospital should not close. But he is a general practitioner. He's a local family doctor, and the local family doctors in the UK have been given the power over almost the entire health budget of the UK. It's the massive revolution, and a different version of it, I think, is happening here in terms of much more local-based decision-making in hospitals. But in many countries, this is going to happen. And it's all about community and patients and being closer to those that make the decisions and allowing families to have a voice and all that kind of stuff. But it has profound implications for just about every aspect of this competition. And one thing I want to say about medtech is that the competition is getting complicated. Because in the age of austerity, I mean, I think of my friends in Greece right now. In the age of austerity, we have rationing, not just between a modality of treatment for, say, cancer reconstruction of breast surgery, but we're dealing with quarrels between breast surgeons and cardiovascular surgeons for budget. We're dealing with quarrels between education and health for budget, between health and defense for budget, between prevention of infectious disease in children versus care of the elderly and joint replacement and dementia research. These are huge, hugely important debates which will cloud every decision about medtech for the next 15 years or more, 20 years, 30 years. Rationing has always been with us, but now it's being formally acknowledged right out because of the austerity issue. And rationing, the rationing is being influenced irrationally, irrational rationing, because of course it's emotion which is driving a lot of this. Patient campaigns, what they read on Google, we have legal and IT related decisions which aren't necessarily in the best interest of patients. We have financial incentives which we've talked about, whether it's the surgeon jointly financed with the hospital and so on. Many of these things are changing. Patient experience, local skills and experience, whether there's the local infrastructure to take advantage of it and so on.